Today, we are going to understand Glanzmann's Thrombasthenia, a rare but very important platelet function disorder that is frequently tested in exams and clinically significant due to its bleeding manifestations. Let's build this concept step by step, starting from the basics. First, we need to understand how normal platelet aggregation works. Platelets are produced in the bone marrow from megakaryocytes. Once released into circulation, they play a crucial role in stopping bleeding. When a blood vessel is injured, platelets adhere to the exposed collagen and become activated. After activation, they express specific surface receptors that allow them to bind to each other. The most important receptor involved in platelet aggregation is the GPIIb/IIIa receptor, also known as integrin alpha-IIb beta-3. This receptor binds to fibrinogen, which acts like a bridge between platelets, allowing them to stick together and form a stable platelet plug. So, in simple terms, fibrinogen plus GPIIb/IIIa equals platelet aggregation. Now let's see what goes wrong in Glanzmann's thrombasthenia. In this condition, there is a genetic defect in the GPIIb/IIIa receptor. Because of this defect, platelets are unable to bind fibrinogen. As a result, they cannot stick to each other properly. This leads to impaired platelet aggregation, even though the number of platelets is completely normal. So remember this key concept. In Glanzmann's thrombasthenia, backhand index pointing right platelet count is normal, backhand index pointing right platelet function is defective. This failure of platelet-to-platelet cohesion is the core problem in this disease. Now let's move on to the clinical presentation. Patients with Glanzmann's thrombasthenia typically present with mucocutaneous bleeding. One of the earliest signs is petechiae and purpura, which are small pinpoint or slightly larger bleeding spots on the skin. Another very common symptom is severe epistaxis, meaning recurrent nosebleeds that can be difficult to control. In females, menorrhagia, or heavy menstrual bleeding, is a major clinical feature and can significantly affect quality of life. Patients may also experience bleeding from gums, especially during brushing or dental procedures. A key feature to remember is that these patients often have excessive bleeding even after minor trauma or procedures, such as tooth extraction. In more severe cases, there may be gastrointestinal bleeding and rarely life-threatening hemorrhage. The severity of symptoms can vary depending on the subtype of the disease, commonly classified as type 1 or type 2 Glanzmann's. Now let's move to the laboratory and diagnostic findings, which are very high yield for exams. First, the platelet count is normal. This helps differentiate it from conditions like thrombocytopenia. However, the bleeding time is prolonged, or in modern testing, the PF-100 closure time is increased, indicating defective platelet function. Importantly, routine coagulation tests such as PT and APTT are normal because the coagulation cascade itself is not affected. The most characteristic lab finding is seen in platelet aggregation studies. There is absent aggregation with physiologic agonists such as ADP, collagen, epinephrine, and thrombin. However, aggregation with ristostin is normal, which helps differentiate Glanzmann's thrombasthenia from Bernard-Solier syndrome. For definitive diagnosis, flow cytometry is used. It demonstrates a deficiency or absence of GPIIb/IIIa receptors, specifically CD41 and CD61 markers on platelets. This confirms the diagnosis. Now let us discuss the management of bleeding episodes. For mild bleeding, especially mucosal bleeding, antifibrinolytic agents such as tranexamic acid are very effective. These drugs help stabilize clots and reduce bleeding. In more severe or prolonged bleeding, platelet transfusion may be required. However, this must be done with caution because repeated transfusions can lead to alloimmunization, making future transfusions less effective. In refractory or severe cases, recombinant factor VIIa can be used as a life-saving therapy. Additionally, local measures such as packing, pressure application, or topical thrombin can help control bleeding at specific sites. Management always depends on the severity and location of bleeding. Now let's move to preventive and lifestyle measures, which are equally important. One of the most critical precautions is to avoid antiplatelet medications. Drugs like aspirin and ibuprofen can worsen bleeding and should be strictly avoided. Maintaining good dental hygiene is essential to prevent gum bleeding. Patients are advised to use soft-bristled toothbrushes. For women with heavy menstrual bleeding, hormonal therapy, such as oral contraceptive pills or intrauterine devices, may be helpful. Patients should also have proper pre-procedure planning before surgeries or dental work to prevent excessive bleeding. Monitoring iron levels is important because chronic blood loss can lead to iron deficiency anemia. Finally, let us review some high-yield reminders and complications. Glanzmann's Thrombasthenia is an autosomal recessive genetic disorder, meaning both copies of the gene must be affected. A critical exam point and clinical advice is: backhand index pointing right. Always avoid antiplatelet drugs. Complications mainly arise from chronic or severe bleeding. These include iron deficiency anemia due to repeated blood loss, and in rare cases, intracranial hemorrhage, which can be life-threatening. There is a potential curative option, which is hematopoietic stem cell transplantation, but it is rarely performed due to its high risk. Therefore, most patients are managed with supportive and preventive strategies. Genetic counseling is also recommended for affected families. Final summary: Glanzmann's thrombasthenia is a platelet aggregation disorder caused by GPIIb/IIIa receptor defect, leading to normal platelet count but impaired function. It presents with mucocutaneous bleeding, shows prolonged bleeding time with normal PT and APTT, and is confirmed by flow cytometry. Management focuses on controlling bleeding and preventing complications, with strong emphasis on avoiding antiplatelet drugs.